जाईल ना ऑटोमॅटिक.
स्क्रीन शेअरिंग.
चला बोलू. ठीक आहे. ओके सर. हा मी स्टार्ट करतोय. आवाज येतोय तुम्हाला मॅम? समीर सर.
हा इथे ना टॉकिंग टू मोबाईल वरती असेल तर मी बाहेर बघतो. आपल्याच मोबाईलवर लॉग इन करून द्या. सिंपल लिंक ती
लाईव्ह स्ट्रीम
बाहेर जातो.
जस्ट 1 minute. He is confirming.
हा
लाईव्ह स्ट्रीमिंग स्टार्ट केली. फक्त तो चेक करतोय.
अभिषेक तू झालं की सांग मग अभिषेक.
हो
रेसिडेंट्स
kindly be patient. We'll start in few minutes.
सांगते तुम्हाला.
Ma'am, we are good to start. Ma'am, we are good to start.
अभिषेक मोबाईल सगळ्यांना सायलेंट करून.
I request everyone to keep your phone on silent. We'll be starting in 1 or 2 minutes.
तुमच्यासाठी यांनी सुरू केल्यावर अभिषेक चला. अभिषेक तू सुरू करतो.
तुम्ही बोलू शकता. Good afternoon, everyone. Today we have gathered for the guest lecture on the topic Nurturing the Developing Mind, which is organized by Department of Pediatrics, Dr. Patil Medical College and Hospital, Pimpri, Pune. So the guest speaker we have here is Dr. Anagha Jayakar, ma'am. She is a coordinator of AACCI, CCIAIF. Yes. Okay. I would like to call Shailija Mani madam. Yes. I would like to call Pandey madam from Department of Pediatrics and Dr. Swati Bhave madam. Yes. Now I would like to call Shailija Mani madam to felicitate Dr. Anagha Jayakar madam. Now I would like to call Dr. Vinita Pandey madam to felicitate Dr. Swati Bhave madam.
Very good afternoon to all. It's my honor and privilege to introduce Dr. Anagha Jayakar madam. First, I would like to thank Dr. Swati Bhave madam, who is our guide and mentor. She is Executive Director of AACCI. AACCI is an Association of Adolescent and Child Care in India. We are having an excellent website. Those who want to volunteer for it, There is no fees for joining it, and those who want to volunteer, please visit the website www.acci.in. We are having various forums like teacher forum, adolescent young youth forum, then parents forum, grandparents forum, and I welcome Dr. Sandeep also, who is actively involved in AACCI, and we all are volunteers of AACCI, and we are for the well-being of children and adolescents in our country. So you all can join, and you can grow as a person as well from inside. Madam, Dr. Swati Madam is a Professor Emeritus of our Department of Pediatrics in our college. Thank you, Madam, for sparing the time from your busy schedule. I would like to welcome Dr. Anagha Jayakar Madam, who is a community pediatrician and head of Department of Tasmania University Community Medicine, Tasmania Community Pediatric Service and Royal Hobart Hospital at Tasmania, Australia. She is all the way from Australia here, and whenever some person comes from who is Indian and who comes from outside, is having so many commitments, meeting the relatives, meeting the friends, families, and so many other things. So we are very much thankful, Madam, for sparing your valuable time from your busy schedule, and we are eager to learn and understand about how to nurture the developing mind. Please go ahead. Thank you. I will request Madam to join the audience.
Thank you very much for the honor and the privilege of talking to such clever people in your institution. And can everybody hear me? Okay, right. So I need to just check that I can do the next steps. Otherwise, Dr. Rohan will have to help me. All right. So I have been in communication with Dr. Mane for some time to decide what would be the topic to take for you all. And this was at her suggestion that we talk about nurturing the developing mind. But I wanted to make it an interactive session. I don't know how we can do that on YouTube or Zoom, but at least with the audience here, I'd like to make it as interactive as possible. So I might just stop at a point and make you all do some things, and let's see how we go with that. All right. So shall we begin? Thanks for your patience in waiting till we started. So nurturing the developing mind, I just thought I'll look at awareness to action as how do we go about doing that. Now, which is the next thing? Okay, next, what is that? It is not going. I did the arrow. This one? Okay, now when we go to the next. Okay, what's a shift? Okay, so our objective today is to understand this subject and implement this understanding through using reflective practice and some healthy conversation skills. Okay, so just to make it simple, I'd like you all to think about what these terms mean and write them down just for yourself. Take a minute if you like. Nurturing the developing mind. So what is nurturing? Yeah, and those who don't have pen and paper can use their
mobiles.
Yeah, you can use the notes section in your mobile just to look at what are your thoughts before, after, how aligned we are to all of it. There's no rush. So I just thought if you take a couple of minutes to write what is nurturing, yeah, what is development, and what is mind. Okay, because we are going to reflect on this, right? So, because otherwise in the afternoon, lectures can be very boring, time to sleep, postprandial. Yeah. So we want to look at this terminology with some more meaning than just listening. Okay. So that's our first question. What are these terms? What do these individual terms mean? Then we look at the second question, which is who needs nurturing? Okay. Yeah. So this is the reflective part of it. Yeah. Who needs nurturing? Yeah. Then the third question to reflect on is, when do you feel nurtured? Right? So we have terminology, what it is, who needs nurturing, when do we feel nurtured? Okay. And then what can you do today to help nurture whoever it is you have in your mind? Okay, so what sort of action? Because we're looking at awareness to action. And then a couple of other thoughts and questions is, what do you mean by reflective practice? Okay, because we're looking at what is, and how can we develop healthy conversation skills? So what is a healthy conversation, basically? Then how do we develop those skills? Okay. Any questions on the questions? Are they clear enough? Is anybody going to be brave enough to stand up and tell me what they've written? Or we can look at it in the end. Yeah. So we'll go through this and then look back and see whether what you have got aligns with what you all have thought about and your reflections on all of it. Okay. So this is not an exam, so don't worry. I'm not asking you all to this thing. Okay. So as a collective, for all of us, what are the basic things we know about ourselves? Okay. First of all, we are human beings. Agreed? We are all interconnected, irrespective of caste, creed, education, qualification, how rich or poor you are, we are still interconnected. Yeah. So we are all individuals with the body, mind, and soul or spirit, whatever you want to call it. Correct? All of us have knowledge, skills, and experience. Each and every one of us have a skills, knowledge, and experience. Yeah. And this is shaped by our nature and the nurture we receive in our lives. That's simple, nothing, I'm not making it complicated. Yeah. And how we act impact others and as well as ourselves. Right? And we have the capacity to change and grow. Right? So is there anybody who can align with all of this? What are your thoughts on any of this? Anybody, huh? It is again, we said we all have knowledge, skills, and experience. So once that comes in the picture, there's no hierarchy. Yeah. As human beings, we are all interconnected. There's no this thing. So whatever your thoughts, is anybody wanting to think about this? Do we all agree we have the capacity to change and grow? Yeah. So that awareness to action is just getting aware of these basic concepts about ourselves, yeah, as human beings, yeah, about our connections to each other. Yeah, who's that? Oh, that's my recording. Okay, somebody wanted to speak. I said, how nice. Okay, we don't have the capacity to ask people on Zoom, sorry. But Ponalaka, any thoughts on it, anybody?
The statements are true.
Yeah.
They're definitely, I don't think there's a doubt
Yes.
about any of these statements.
Yeah.
But there's definitely a lot of variability.
Correct.
So that's where I guess the differences sort of arise.
Yeah. So for those who are online, what's your name, please?
Pooja.
Dr. Pooja is saying that all these statements are true, but there's a lot of variation in our understanding of these statements. And that's, I think, where the differences in the problems come. Yeah. And so probably what we have to do is when there are these differences that come up, we have to go back to the basics and think we are still interconnected. We are still human. We are still, we all are equal in that capacity of ability to change. So take a deep breath and think about this before we get into conflicts. Yeah, because that nurturing has to happen. And how can we nurture if we don't understand our actions? All right, great. Thank you, Dr. Pooja. Okay, so when we go to the questions we've asked, okay, what is reflective practice? Okay, it is an ability to observe and think about something, stop and explore knowledge, thoughts, and feelings of this experience and the impact it has on you. Okay, so if we develop these reflective practice skills as a medical student, as an intern, as a teacher, as a trainer, it will stand us in great stead all our lives. Yeah, and so this is really, really important for every one of us. And an ability to discuss and share these reflections in a structured setting as individuals and all then becomes a reflective practice session. Yeah, we have to actually learn the skill of reflective practice for ourselves. And then if we want to have, your peer group reflections or a case study, case discussion thing, you have to look at it from, okay, what have I learned from this? What can I do about it? How has that impacted me? How has that impacted the patient? And how do we as a collective learn these experiences and share them? Okay, so it's very, very simple. It sounds very big and, reflective practice, having sessions. But if we develop the skill for ourselves in our day-to-day functioning, we are all impacted by everything that we see and do, isn't it? So if we learn to reflect on it, we can be better at reflecting and you can get skilled at it. And then you can take this step back and understand its impact, not only on the people we interact with, but also on ourselves, because it's a two-way process. Yeah, that interconnected thing which I said, that applies for this. Yeah. So we look at all that we have talked about afterwards in what you'll have written, but that was important. So how do we unlock this reflective practice? Yeah, what does it do? It promotes critical thinking. It enhances, thank you, enhances self-awareness, and it supports continuous improvement. Okay, so how does it do that? It allows us to think about our experiences, and then it can help us in improving decision making, and that will help us for improving our future outcomes, future situations, because we've learned from whatever the situation is. And if we can learn from that, we can change it for our next actions. Would that make sense? Then it also gains strengths and areas for growth. Okay, this is something I need to upskill on. And it's an internal reflection. You don't have to necessarily share it with everybody. And then it will increase not only your personal self-awareness, but will also improve your professional self-awareness. Yeah, because as teachers, we all learn from students as well. And the more we question each other, the better all of us learn. Okay. And then this regular reflection fosters ongoing learning and adaptability. Yeah. And then this skill can then be applied to new challenges in other areas of our life, because it's a skill you're learning. Okay. You may learn it here in a medical school for case discussions, but in personal life, personal challenges, interacting with family, interacting with peers, there are so many areas where you can utilize this skill to improve your self-awareness and others, interaction. Yeah. So we can use these skills. Okay. Then the next part was looking at healthy conversations. I'd asked you all to write. So what is healthy conversation? Being able to talk and listen. Yeah. And for that, what do we need? Okay. You need respectful attention. Okay. You need a willingness to listen. I was looking at some of these debates on your TVs. Nobody's listening. Everybody's just talking over each other. Yeah. And it's not a criticism. It's just an observation. Yeah. So unless you can listen, how can we respond? People have come with their own agenda to blurt it out without actually participating in what we would call a healthy debate. Yeah. So for healthy conversations, you need open-ended questions. Yeah. So what do you mean by an open-ended question? Can anybody tell me what is an open? Yeah, please. Just tell me your name so that I will. Dr. Manjushri, yeah,
The question doesn't have an answer of yes or no.
perfect.
So the
Yeah, open-ended question is when the answer you expect or the person can give will not give yes or no. Because when it's yes or no, the conversation is closed. So when you want an answer which is meaningful, you use open-ended questions. Can you tell me what, give me an example? I'm putting you on the spot if you wish, okay?
yeah,
You can speak, no problem.
yeah, like how is the weather like?
Okay, yeah, yeah,
How are you feeling?
good, good.
Some
Yeah. So what she's used is how. Okay. How is an open-ended. Whatever you ask with the word how becomes an open-ended. The second open-ended, really open-ended question is what. Okay. So what and how are two open-ended questions whereby you allow a conversation to begin. Okay. And so that I think is really important. Then you can ask further details like when, where, more details are more specific, but they're not open-ended. They're sort of little closed, but they're not completely closed. Yeah. So two like even if you want to open any question conversation, you start with what, or how are you, how, what are you doing today, and then wait and listen. That's more important. Yeah. So that is a healthy, respectful conversation skill to have. Both attention, asking open-ended questions, and listening to the answers and responding. And that again is a skill which has to be developed. It has to be consciously done. Or when you observe, you can see when the conversations close and all. So I'm just making you all aware. So I said awareness to action is what I want to do today, is discuss some skills, make you all aware of it so that you all can take these actions moving forward. So I'd like to do a small icebreaker, looking at these two sort of skills. Okay. So if you turn to each other in the thing and talk to each other about something about, like for 2 minutes and 1 minute for each person, talk about what or how about anything other than, whatever you want, and see what the response is. Okay. Can we have a 2 minute sort of timer thing or whatever? Yeah. Just between y'all. I don't want the answers. I just want y'all to use the skill.
Continue.
Hmm.
And then if you observe how people are and then you interact, and you lower your own, you will also reach it. That's called co-regulation.
इकडे एक मीटिंग चालू आहे ना मेंटरला तेवढं काय सांगायचं आला निखिल
So you have the verbal conversations.
झालं
थँक्यू हा बाबा आम्ही म्हणून बरं
बोलून घेतले सगळ्यांना
Try to form the next answer. You're not actually listening to the question or listening to the point from the thing. And that is when we are getting a skill which can be learned and built. And that we do so everybody stress your express on whatever what goes on. And that is also part of nurturing. It's about self-care. Yeah. It's about self-care. Learning how to take care of yourself and nurturing yourself. How can you learn that nurturing? Who needs nurturing? How many is right? How many people you need to yeah. Or is it only your children or your family or others? But they do everything. It's not just seeing. When you're so busy nurturing everything. Excellent.
So we extended our icebreaker 2 minutes to 5 because of the connection, but I think it gave the people online also a chance to think about these two skills and how they can implement it in their lives. So let's move forward to the 3 words, the things, what is nurturing that you all had written. Okay, can you tell, I can't do it as an exercise, otherwise there's an app in which you can put that and then it comes up. That is too technically complicated for me. So can anybody who's written what is nurturing, can you tell me any word that you'll have written? Support, what is it? Attention, guide, yeah, care. Excellent. So lots of words come to mind when we say what is nurturing. Yeah. So basically it is being let's look at children because we are all mainly pediatricians, but like nurturing relationship with children would be, or adults or anybody in our lives, is being loving and kind and compassionate. Okay, being fully present in your interactions, both verbal and non-verbal, as I've discussed. Okay, providing physical affection and comfort, but only when sought. That is really important. The kind of physical care and comfort you offer has to be an invited thing, taking permissions and all of the things, and as much as the distressed child can tolerate or need. And then at the heart, basically, of a nurturing relationship is acceptance. Acceptance, true acceptance of the person as they are is the best nurturing that you can do for them. Okay, so when we talk of unconditional love or unconditional care, it all boils down to accepting the whole person as and when, faults and all, everything, accepting, not trying to impose our sort of expectations. And then that is genuine nurturing. Okay, embracing them for what they are and not for who we wish them to be. Okay, and that again is something a lot of families, parents, teachers, peers, everybody want something else from somebody else. But if you really care and respect and love them, accepting them for who they are without wishing to change them would help them grow into what they want to be. Okay, so what is the power of nurturing? Okay, the power of nurturing is really providing ongoing support and encouragement, yeah, which will help them to flourish and grow in all aspects of their life. Okay, it will help them build trust and security. Yeah, it will foster emotional stability and will sort of help with healthy relationships. And healthy relationships, not only parent-teacher, parent-child, peers, wives, their children, ongoing, they will get that trust and encouragement. So what you do in a moment can actually impact them for a long time, and you don't know what the impact will be. But you can just provide that momentary sort of opportunistic intervention by this thing. So it will help them to become confident and resilient, okay? Because they can reach their full attention and their full potential if they feel accepted for who they are. And then they can help. As I said in the beginning, you remember, we are interconnected, we can change and grow. But we can only change and grow when we have accepted who we are and we wish to change and grow. Telling them to change is not going to change them. Correct? So imposing our wishes, our ideas onto our children is not actually helping them to be who we want them to be. Yeah? Right. So then we go to nurturing the developing mind. So the second part of my thing was the developing. So what are, the stages of development we all know as pediatricians, we've done milestones all our life. We know that milestones are sequential life stages. Yeah. They go from sort of antenatal fetus development to infancy, then to childhood, tweens, teens, adulthood, and then end stage. So all of it is development. Okay, so we have an ongoing development through the life ages and stages, but the brain develops first 23 years into getting the maturity. Yeah. So the growth in each stage is distinct. It is cognitive development, emotional changes, and that helps us for adaptation into maturation and how we influence ourselves and others. And what are the other influencing factors? We have geneticists here. So genetics, environment, and social interactions all help our stages of development. Okay, because it's these interactions that help progress through each stage of development. Okay, so you all have learned about physical milestones, sit, stand, walk. Then you have the emotional and you have all of it. But ultimately, it's the whole brain that has to develop and mature. Okay. Then the third aspect was, what is the mind? Okay. That's a bit complicated because the mind is not the brain. Okay. So the brain is the structure. So what is the mind? That's a very important thing to consider, isn't it? So it's a basic collection of mental capacities like thoughts, perceptions, and emotions, which encompass consciousness, memory, and reason. So all of that becomes our mind. So it's the data, like in nowadays terms of computer technology, it is the data bank of memory, thinking, and analyzing that part of our brain. There's no point where you can say, this is my mind. Yeah, this is your brain, these are the organs, but where's the mind? It's very difficult to actually pinpoint and say, this is the mind. This is a function, okay? Because you have once attention rests in your mind, once awareness rests in your soul or wherever else. We don't even know where the soul is if we don't know what's the mind, okay? So what we're looking at is the hardware is the brain, the software is the mind. Yeah. In simplistic terms, that would be what we want to say, what is the mind. So, and I had to reflect on this topic when I said nurturing the developing mind. What do I call the mind? Yeah, what do I call the mind? And that was really why I thought, let me ask you all to reflect on what actually we were looking at when we say this is the mind. Okay, but when we are exploring the mind, it is the center of thought and attention. It generates our thoughts, our processing emotions, maintains our sense of consciousness. Okay, it enables us to analyze information. It helps us to make choices. It helps us to problem solve in everyday life. Okay, so it is also important for us to understand this mind to improve our mental well-being. Okay, to help us boost our creativity and help our problem-solving skills. So it's our mind, the analytical part, and the emotional problem-solving skills which are there. So in a short, it could be like our executive functions, yeah, are that part of our mind. Okay, little bit about the brain development, which we all know. It is from utero to early infancy, yeah, and all the time, even in utero, our brain processes non-stop signals from our senses. Yeah. And then what happens is that raw data enters the lower part of the brain, which then leads to a multi-systemic patterns which happen. And this pattern recognition then becomes stored as previously recognized patterns. Okay. Then the midbrain and the limbic system develops in the first 3 years of our life. Okay, so that's the second part. Okay, and your hippocampus, I'm not giving you an anatomy lesson, but you're looking at the limbic system. Yeah, your hippocampus and the amygdala are your memory of the brain and the emotional centers. And these organs cannot tell the difference between real and potential threat. Okay, and that's really important for them. They will believe all threat is threat. Yeah. So that's why you have your flight, fight, freeze reactions, which we talk of in your trauma work. And then you have your prefrontal cortex, that is the front part of your brain. Now, that is where your executive function is, but that actually matures from 5 years to late teens. And sometimes we expect our children to be more mature than their capacity to develop. Okay. And so when you expect a 4-year-old or a 3-year-old to sit still in class on a mat, it's impossible. Then we will label them as ADHD, which is not true at all. They have not reached that developmental stage in their life. Okay. And it's our role as pediatricians or pediatric trainees or, educationists to be able to explain to the parents, this is not ADHD. He has to move around and explore, and expecting him to sit still for more than 2 minutes for a 2-year-old is outside his capacity. His prefrontal cortex is not even developed. So how is he going to have impulse control? Okay, so that's really the reason we need to understand it in depth so we can explain it as it needs to be explained. Okay, so then we come to the question. Sorry.
What is the hand model?
Yeah, I'll do it. Yeah. I have not talked about the hand model, but I can. Have I put that's in the ADHD?
This side.
Okay, I'll talk about it. But we are looking at how. Let me talk about it since you brought. So the hand model of the brain is a way we can explain the brain to a parent, a child, or anybody. Which is all of y'all can put up your hand, right hand. Okay, any right or left. Okay, then you put this thumb inside. Yeah, and then fold. Perfect. And then this becomes your spinal cord. Okay. This part of it becomes your brain stem. Okay, which I said the brain stem part. This is your limbic system. Okay. So this is your reacting brain, this part. Okay, the palm. This is your limbic system, which connects the reacting brain to the thinking brain. And this is your cortex, the outer part of the brain. Okay. So the front of it is your prefrontal cortex. And the prefrontal cortex is where your executive function happens. Okay, so executive function is planning, organizing, impulse control, all the other executive functions, critical thinking skills, etc. So this develops after 5 years. Okay, so whatever they're doing before that is what they have learned. They're not doing it independently. So they are following and mimicking your environment. Okay, and from the environment, they're getting pattern recognition and their behavior sets. Okay, but the executive function skills develop later. Yeah, so we are the ones who will model these skills for them, and then they will use our behaviors as patterns, as recognized patterns for their behavior. Does that make sense? Yeah. So that's the hand model. So if we want to understand how to nurture the developing mind, that there are things which are the understanding the importance of the caregivers. Parents are teachers, as I said, are the role models for the children, but grandparents too, and everybody who is connected to the child. What used to irritate me most was the doctor aya injection day. Okay, how many of you all have experienced that? Okay, this threat to a 1-year-old who has no concept of a doctor, they've had a concept of an injection, but they have not been explained why she should get that injection. What is she doing? She's sitting there playing. Baga, injection thi de. Who is she in the whole scheme of things? So perceived threat and this thing. So agar we gambat karti, I said, this is not gambat for the 1-year-old. You know, So you have to understand. I'm sure how many of you have had this experience, even as medical students. Yeah, we've all had. Okay, this is a standard threat for no rhyme or reason for children who don't even understand what you're talking about. Okay, and then I don't understand the gamma thing is. Yeah, is that it? Yeah. Okay. So importance of caregivers, parents, and teachers is to understand that whole nurturing aspect. Okay, and understanding the parenting styles and its impact, and understanding adverse childhood experiences and its impact. I'm not going into details. I'm just giving you an overarching thing. Okay, and then most important is developing a nurturing relationship. Even if there's one kind-hearted soul who's a nurturing person in that life, you will remember that person all your life for whatever lessons and whatever they've done for you in their childhood when they're long past and gone. Okay, so that nurturing relationship is the core for a person to be able to have that experience of nurturing so they can nurture others. Okay, if they've not had that experience, how would we expect them to, do that? So we have to start. The first 3 years are so critically important in that child's life to have these relationships, not just with the parent, grandparents, and everybody else. Okay, and what we need to provide for these children is psychological safety. Okay, physical safety, of course, it goes without saying. You need a house, you need food, you need shelter. But in addition to the basic needs, for them, for their well-being, for their nurturing, psychological safety is absolutely essential. Yeah, and that psychological safety can only be provided by consistent nurturing relationships. Okay, that's really important. So, and as the child grows older, we have to provide them with a free mental space with which to come to their own conclusions. And we have to have firm, sure modeling and guidance, which every child deserves. Okay, absolutely every child deserves that. Okay, and it's free. If we understand it, we don't have to actually pay for doing that. We just have to teach our parents and families to acceptance as one of the key things. Okay, so a little bit on parenting styles, just to give an idea. It's not to criticize. Okay, the whole idea about this is we are not aware of our parenting styles or the styles that our parents used and how that impacted our relationships or our interactions. So I'm just going through 3 or 4 parenting styles. And again, no style is right, wrong, good, bad. Each of them have their place. All parents nurture or parent according to how they were parented. Okay, so this is an intergenerational parenting style that comes through. And if you've been parented in a particular way, then you can accept it and be like that unconsciously, or you can consciously be opposite to what they were. Okay, so both things, it depends on your self-awareness and skills. My parents did this, so I'm never going to do that for my children, or I'm going to follow the same thing. What direction you take, I'm just saying be aware of this. I'm not saying none of it is right or wrong. All of it is a product of our relationships, our lives, our experiences, etc. So there are certain parenting styles. One is authoritarian. Okay, what happens in authoritarian parents? Okay, they are rigorous and they have high expectations of the child, but little softness or little responsiveness. Okay, so here they are focusing on obedience, their discipline, control. Okay, and they'll use hostile power or punishment to demand compliance or obedience. Does that make sense? So this is when somebody is like this, that's an authoritarian parenting style. Okay, it's not an authoritative parenting. We're not always all these things. Okay, we can move from one to the other depending on situations. But by and large, you're predominantly one particular parenting style. And that is where our awareness has to come. And that is where, those initial things we said that awareness can help us action and change and grow. So understanding our own parenting style or somebody you observe or other children will help you. Okay, what is the impact of an authoritarian parenting style on the child is important. That child will have low self-esteem and efficacy because they're not used to making decisions. Okay, they're not used to using judgment. They have to follow the controlling line. Okay, and this becomes a problem for them. They could be emotionally withdrawn because they're not being encouraged to think and they're not being encouraged to express, and therefore they can't manage their emotions. Okay, and then they will, as they grow older and they get more control, they will be rebellious. Okay, they will rebel towards authority. Yeah, and again, they'll also rebel due to the power struggle, but also expectation fatigue. A lot of Indians expect children get expectation fatigue because a lot of Indian parents put a lot of expectations on their children. And I don't say that in a way that is good or bad, but it's because we are very competitive, because there is so much, the high population, the advantage, etc. So Chinese and Indian parents overall have got really high expectations. Okay, not just Indians. I think Chinese are more than Indians in a multicultural world. But that expectation fatigue becomes really exhausting for children. Okay. Then you have a second type. So I said that was authoritarian. This is authoritative. Okay. Here, this is optimal because they are authoritative, but they are placing a high value on the children's emotional needs and attention, affection. Okay. They will model healthy boundaries and relationships and encourage self-reliance. This means providing a safe and stable environment and warm and loving care with predictable rules. See, all children need boundaries, okay? And when they need boundaries, they need rules which are predictable. So they know the expectations and then they feel what I talked about earlier, psychological safety. That's how children feel safe. They know their boundaries. Of course, they're going to, test our boundaries, test our thing. But if the consequences remain consistent, then they feel safer than erratic boundaries. Okay, so that's really important. And so with these sort of parenting styles, the child has a higher self-esteem and they can then achieve higher academic achievement. Okay, so I just given an example. Okay, a child breaking a controller after losing game. A lot of parents will say, okay, no more games. I'm hiding this. I'm not going to give you another controller. After your exam, we'll see. That becomes a punishment. Okay, in an authoritative saying, they can say, I understand that you are angry, that you lost it. It's okay to be upset when you lose a game. Okay, I would also be upset and angry, but it's not okay to break our valuables when angry. So you're explaining those sort of boundaries and why. Okay, you can empathize with the emotion of losing a game and also empathize with the thing that, yes, but where is your control? So this sort of a change in how we behave rather than taking that Xbox away because the controller thing has been the same is really important to understand in a parenting style. Then we have what is we call a permissive parenting, where it's basically an indulgent parent. Okay, very high responsiveness but low demandingness. That means I'll give in to whatever you say. You are my ladla, beta, beti, whatever. So, you are the center of our universe and everything you say is gospel truths. Okay. So they struggle to set rules and expectations. They prioritize they care about, all the parents care about the children. I'm going from that premise that they all care, they love, they want the best for their children. So that's not a question. But the style of how they parent impacts the children. So here, they prioritize the emotional needs and happiness. They don't want this child to cry. So anything, oh, he's going to cry. So let me give him this before he cries. Okay. They struggle to say no when the child demands something, and the child's demands will go on increasing. You'll see that he will want to eat food and he'll want to play or he'll want to run around. Mother will run around. Have you all seen that happening? They'll run around with the food, bharwaila. When the child is completely capable of eating, there's no need to feed children. They're not going to starve. But we have this need to feed. Yeah. So we will run around and then he will draw circles around the whole family. Yeah. And then I have to watch this game or I have to watch this TV, only then will he eat. We have set this habit. And that's really, so not to set it is better than trying to break that habit. Okay. So this child rules the household. It displays self-centered behaviors, emotions, and then these are the children who come to you all with behavior problems. Yeah. And low self-esteem and self-reliance is because they are dependent on the parent for everything. Yeah. So they are not learning self-aware management skills. They're not learning managing the emotions. And that's what, where with the best of intentions, permissive parents have children with behavior problems. Okay. And then you have the last, which is really looking at parents who are not involved, where parents are so busy either in their life, in their career, in their emotions, in their divorces or whatever else, or high society or whatever it is. But they are so busy, they're not demanding anything from the child and they're not responding to the child. So it becomes sort of neglectful. Okay. Again, with the best of intention, if they are on a career path which needs that they have to travel 3 hours here and there, where is the energy? Yeah. So again, we are not talking of blame. I'm just talking of how the children are parented today because of the societal pressures around. And then this becomes, they provide the basic needs, clothes, food, shelter, but the psychological safety of having a parent attend to their needs at that time is lacking, not because of wanting to do it, but because of the demands of their work or, what. And these are the children who have an impact of low self-esteem and poor mental health. Okay. And because they forever need validation from somebody else. They need somebody to say yes. They need that attention. Quite often these children throw tantrums because that's the only time the parent has energy to give them attention. So it's really important before we talk of behavioral problems. No, I'm good. Thanks. Okay. Thank you. Yeah. Before we talk of how, because all, in a neurodevelopmental or behavior clinic, they'll all come with this child is the problem. Okay. But it's not really that. The child is fine. His behavior is a problem, but his behavior, if you reflect on it, is telling you something about his emotions and his reactions to the environment and to the parenting styles. Very hard to explain that to parents that he's not the problem, the environment is the problem, and that environment has to be managed in a way. And again, when we put no blame, no shame, it is just keep providing this reflective understanding to saying, what can we do? Again, using this healthy, what do you think you can do that will change this? What step can you take as the first step to help you accept this, thing? So that's important. So basically, in short, it is parenting is children are influenced by parental behavior. And if you want to nurture your child, you begin with understanding some of the following things. How was I parented? Okay. Again, as reflecting, did I get yelled at? And of course, in the past, a lot of school teachers used to beat children. Yeah, that was the norm rather than an exception. So we cannot, intergeneration things have changed a lot. But did I get yelled at? Did my parents understand my worries? And because this impacts how we parent. Okay, none of our parents are bad parents. And we can make changes, but we need to make an effort. Okay. And then very often I tell the parents, you work on your own behavior and see how it impacts the child. Work on your own interactions with each other. Just reflect on what we talked about before. Reflect on how we model. The children are just modeling what they see. If he's swearing, I don't need to ask who's swearing in the house. They come with children swearing, children biting, children, being hurtful. But you have, they say, oh, must be the TV, but it would also be the environment. Okay. So we need to actually frame our thinking of the parental role. Okay. It is not to rule over them, but to guide them. Not to scare them into compliance, but to keep them safe. Not to make them happy. Okay. But to accept all their emotions. they are supposed to have all the emotions. They're supposed to feel sad, angry, hurt, worried. We have to accept all of them and help them navigate those emotions rather than say, no, don't feel sad, that way. And then we can't shield them from problems, but we have to help them solve the problems. And we cannot actually demand obedience. We have to encourage cooperation. Okay? So parental approval and presence is the most powerful tool for nurturing. Okay? And parental disapproval can be very, very devastating. If it is repeated, the child resents it and resists it. Okay? Therefore, disapproval should be used very, very sparingly. And absolutely, if it is going to, cause a very big consequence, like running across a road without holding the hand, you have to disapprove because it's safety. Yeah. So those sort of things you have to put those guidance into place. Okay. And then explain then that it's the behavior which is being disapproved, not the child. Okay. So the behavior can be the thing outside the child. Okay. This is this angry lot of behavior. You're not an angry you're not an angry child. Your behavior is an angry behavior. Okay. Magic words are actually, I see what you're trying to do. That means I'm understanding your efforts. I can see that you're feeling sad. I can see you're this thing. Okay. Being understood is a huge achievement for this child. Okay. And that's the sort of thing. Can I show you a way if he's frustrated? Can I show you a way to see it done? Oh, or you want to do it by yourself? That's fine. We can wait. When you want my help, ask for it. I'm there. Okay. Then the child feels helped. Okay. How much time do we have? 5 minutes? Okay. I just want to talk about aggression because a lot of children are getting more and more aggressive. So just what is aggression? Okay. Children are testing boundaries, especially when they are young, when they lack self-control and they lack vocabulary. Okay. So a toddler biting is, ouch, that's really hurt. I'd rather hug you to make me feel. So you can give him an option of, okay, you want a connection, but you don't have to bite me. We can have another way to do it. Okay, so you're reinforcing and explaining. Let's show how to be gentle and kind in a gentle way. Fighting with others is a way to make yourself feel better, but it does not work. Okay, people fight due to their own fear and insecurity. Yeah, and if one of them, fighting would end if one of them did not feel the need to feel control or feel superior. And that is called yielding. And yielding is not bad, it's common sense that there's no need to fight for unimportant things. Okay. And then again, when their children are angry, anger is a natural emotion. Guide them through this process. Okay. Allow them time to settle and breathe. Okay. Stay present and available. And then again, those healthy conversation skills. Yeah. What are you feeling? Are you angry? Yeah. Who are you angry with? Yeah. Are you ready to work through your anger? What would help you to work through your anger? So this cannot be done when he's angry. Okay. You have to allow that whole emotional volatility to settle down. And when they are ready for any sort of a discussion, that depends on the age of the child. Right? So just to summarize, it is what we did today was understand the title, Nurturing the Developmental Mind. We looked a little bit about reflective practice and how we can implement it. We looked at what are healthy conversation skills. We looked at how to nurture, some parenting styles, parenting roles, and a little bit of managing anger and aggression. So if you want to revisit your first reflections and look at those questions and the answers you wrote, has this discussion improved your understanding is what I'd like you to reflect on. Yeah? What?
Somebody said yes.
Yeah. Just look at what you have said. And as I said, everybody has their knowledge, skills, and experience. So you have put it in that way. And what we've done is just probed a little more in depth this aspect of the question. Yeah. All right. Any thoughts, reflections, questions? I don't know if this is what you were expecting, but yes,
You said about nurturing yourself.
yes,
Sometimes you yourself have a lot of things to say.
yes.
So in that case, how do you do the recruitment?
So he's asking as a young adult.
Yes, yeah, no, that's fine. So, yeah, so the question is, you want to come here so that everybody hears? So, when we are talking about nurturing ourselves, how do you want to nurture yourself when you have things to express? Okay, are you talking as conflict resolution or just in what way?
It can be either way, like.
Yeah, so, yeah, so when you're looking again as conflict resolution, yeah, so it is when the other person is ready to listen. Okay, that is equally important, right? You have to have another person there. So you have to find a time when you can do that. And then you say, I'd like to discuss with you what I feel. You know, there is a really good book called what is that? I've forgotten the name now. It's gone from my brain. So there are two ways of being a jackal or a giraffe. Does anybody know that conversation? Marshall Rosenberg. Sorry. So he's got this conflict resolution book. Can I go on to my slides? I might have something on that. Can you? Um, oh,
Yeah, it's-
oh, no, it's not there. Okay.
Is it there in the content?
That's down there. It'll be too long. But basically what you do is you have to express yourself. Yeah. Because otherwise it's going to this thing. If you can't verbally express yourself, you can write it down and then think about it and concise it and then express it. Yeah. Because you have to express yourself in the way I feel this is the thing. You know, you have to express it as your feelings, what the action you would like to see happen and how to move forward. Does that make sense? I feel sad that you thought this. Okay. What you said this, it made me feel sad. Okay. I would like the, so there are techniques for conflict resolution. There's a whole sort of lecture about that. And
Non-violent, the book name is Non-Violent Communication.
perfect. Marshall Rosenberg. Yeah. So nonviolent communication. Thank you. Yeah. Marshall Rosenberg. Yeah. I just was not, I could get the picture of the book. So Marshall Rosenberg was a psychologist. Okay. And he talked about nonviolent communication as a way of life. And he had these sort of 4 steps about what it is: understanding the need of emotions, expressing the ways to do it, and maybe we should do a seminar or something on nonviolent communication as a next thing, because I've done that training, but it is a whole separate hour which can't be done today. But it was he used that as conflict resolution tool about how to use that so healthy conversation is this big step, but then conflict resolution is something different. And there are sort of steps of understanding what the anger and emotions, which though people have, are an expression of their anger and emotions. So understanding their anger and emotions, your anger and emotions, and how do we come to what you expect and what they expect, and how do you have a common understanding. And sometimes you have to agree to disagree, because that is a mature way of handling. Okay, I understand your viewpoint. This is my viewpoint. Let's just agree to disagree. Yeah, isn't it? Because we can't always agree with everyone. Does that make sense? Okay. Any other reflections? Good point, though. Yes, please.
In nurturing, you said that nurturing is accepting the person as it is and not trying to change. My only elaboration I would require is, whereas when parents come to us, and even the role of a parent is many times to bring about the change.
Yes.
So it is accepting that the child is not at fault, but even then we have to try to change certain behavior, So how does those 2 statements align?
Very good. So you accept the child as they are. Don't accept the behavior. There's a difference between accepting the child and accepting the behavior. So separate out the behavior from the child and say, what can we do to change this behavior? Okay. And what are you doing that is contributing to that behavior? That parents have to be able to reflect on, because they come to us as pediatricians with an expectation that they're paying the fee, now you do the needful, correct? But they are not ready to put in that hard work to change themselves, okay? Or even reflect on their behavior which is impacting their child. And that is the hard part. I'm not saying it's easy, but that is the environment, you know. So, and sometimes if you ask the child innocently, where did you learn this from? They tell you exactly which parent was like that. Okay. Yeah. So, so you know when this is happening is when there is a conflict in the home. That's what the child has seen and learned. And they have learned how to interact in that same way. Correct? It is do as I say, not as I do, which causes all the problems. Yeah. And that's why you have to actually do the parenting skills and styles and education. What your AACCI is doing is educating everybody so that this seeps into society, that this is how we should be doing stuff. Not when the conflict arises, not when the problems arise, but as the first 3 to 5 years are so critical in developing the adult, right? So helping young adults to understand before they become parents how their behavior impacts their children would then reduce the problems. And revisiting and teaching medical students all reflecting skills. This may not be part of your course, you may not pass exam, but it'll be better for your life skills and your life. This may not be a question which will come in your exam, but when you are a parent to your child, if you remember a little bit of this, that's good. Yeah. Thank you so much.
Thank you, madam, for making this actually a little bit difficult topic so easy to understand for all of us. Do you all agree? Yes, and definitely it will be useful, and it will make our lives and others' lives also a little bit better if we follow it. Okay?
Even if you think about it, you'll learn to follow it.
Yeah, good. Thank you, madam. Thanks a lot. And we can plan the next session online. Non-violent communication, which is very important nowadays, even for small children also. Nowadays, violence is a norm because they are in the world which is now at international level, starting from the international and coming to home and vice versa. Thank you, madam. Now I request Dr. Swati Bhave, madam, to give her expert comments and do the needful. Thank you, madam.
Thank you, Anagha, for the wonderful lecture. So I'm not going to repeat what she said, but a few comments. All of us who are pediatricians changed to adolescent pediatrics, calling ourselves adolescent pediatricians. I changed 25 years back. And the first 10 years, we really concentrated on adolescent parenting. We taught the parents a lot of adolescents. And then we all went into a lot of full-time adolescent practice, where we started seeing the parents and the adolescents in our clinical practice. And when we were taking the history, we realized the flag signs of all the behavior with the adults was coming with, whether it was in eating disorders, mobile addiction, academic performance, all flag signs were present below the age of 10. They were not understood or they were ignored. And then we realized that now we have to go back into positive parenting 0 to 10 years. So the last 5 years, AACCI is working very hard to talk of positive parenting 0 to 10 years, a vaccine to prevent adolescent problems. And all what Anagha has said, that if that nurturing, the secure connection, the boundaries, the positive discipline, the parental role modeling, it doesn't take place. The child up to the 10 years is indulged by the parents to do whatever he wants. And then suddenly, when he's a teenager, the problems magnify. And now suddenly the parents want excellent communication with their teens. The teens which obeys their parents, a teen who has values, a teen who understands boundaries. Frankly, it's too late. But But we can say never it's too late. We have to keep guiding adults and parents. But we realize that if we can start positive parenting, which means setting up positive discipline, that means no reward or punishment, because reward is bribery, punishment leads to rebellion. So we talk of positive behavior, positive consequences, negative behavior, negative consequences. So instead of punishing people, we remove their privileges. And this is done with the permission of the child. So the child doesn't say, just because you're a parent, you have the authority, you're punishing me. When I grow up, I'll punish you. So you know what you have to say, like, suppose we decide that the mobile should not be given more than half an hour. Then we ask the child, what will be the consequences if you go beyond the boundary? If you do the mobile 1 hour or video game 2 hours, what should be the consequences? Shall we take away the mobile next day for 24 hours? Shall we take away your mall visit this weekend? Shall I take away your video game playing for this weekend? So you have asked the adolescent or the child also, what is a privilege I'll withdraw? Then we tell them to put it on a bulletin board. And then you don't have to give lectures. You don't have to scream. You don't have to shout. If the child exceeds, you look at the board and say, what have we decided? And then the child has to follow. There's no rebelliousness. So if you start setting these boundaries and positive discipline, 90% of these 0 to 10 children who now are emotionally stable, they know how to regulate their emotions, they know how to process their anger, they know that it is important to follow rules for their own safety and security. You will rarely have a teenage problem unless, of course, he has a psychiatric disorder. Like he has OCD, he has ODD, he has ADHD. So now we are really working on this, and that's exactly what she has brought out. That if you have that positive, nurturing, security, connectedness, will bring out very stable adolescents. Giving an answer about your self-reflection. In WHO Life Skills, we are going to do a program for the residents with Shailaja. Just learn to do what is known as SWOT analysis. How many of you know about SWOT analysis? Strength, weakness, opportunities, and threats. If you become self-aware and you know your strengths and weaknesses, then you have to learn how will I overcome my weakness and how will I strengthen my strengths, so that every opportunity I get is not a threat. I convert the threat into an opportunity. And one has to learn every weakness cannot be or need not be converted into a strength. We have to just be self-aware that this is my weakness and I need to change it. For example, if you're 5 feet, you know it's your weakness, you can't become 6 foot. There's no transplant of the knee, we add 6 inches. If you have got an endomorphic body personality or body of metabolism, you can't be a slim, thin hanger who can walk on the fashion ramp, okay? If you are a mesomorphic, then you can develop muscles. If you're ectomorphic and mesomorphic, you can't be Salman Khan. You can't develop muscles. And if you take steroids, it's harmful. So like if I have specs, I'm not going to do LASIK surgery at the age of 5. So maybe when I grow up, I'll do LASIK surgery. Right now, I can choose good specs to look. So we have to make everybody understand certain weaknesses have to be accepted. Certain weaknesses, especially your behavior. If you have anger management issues, if you're a selfish person, if you are not helping others, these are things you can change. So you can decide what I need to change, what I can improve my strength. Like if I have compassion, if I'm a caregiver, then I should choose like we all are compassionate, we have empathy. That is why we chose being in the medicine profession, because we love helping people, we love curing patients. So if you can do your SWOT analysis, I do it weekly, monthly, yearly, and you have your own graph. If I'm better than what I was 3 months ago, that is progress. Not if I'm better than my colleague, not better than this person. I'm not comparing myself with the world. I'm comparing myself with myself. So if I had a lot of conflicts in my life, and suddenly in the last 6 months, I've learned anger management, I've learned non-violent communication, and now I have less conflicts, my relationships are better. If I've developed healthy habits, I've lost the excess weight, I've become fitter, I am growing every day. And if you do that, you learn to love yourself. And unless you love yourself, people are not going to love you. You have to first love yourself, respect yourself, then it doesn't matter whether the world loves you or doesn't love you. So that is the thing. Every time reflect on yourself and learn to criticize yourself in a very healthy manner, that this is my faults. And we have a Johari window also. You can have your known persona, hidden window. You can look at a Johari window and look at your family to tell you your best. When you're married, your husband and wife are constantly telling you what is wrong with you. So you don't need anybody else. Then you have growing children Teenagers are constantly telling how bad you are as parents. You don't need it. But otherwise, you can ask people who love you, who you have confidence. They are not telling you because one, they're afraid of hurting you. They don't want to hurt you, or they're afraid of your anger and reaction. So you tell them, I really genuinely want to know what are my good points and what are my bad points, and please help me through it. Your children love it. Like, for example, we all are not tech savvy. How our children used to love that superiority, teaching us all the apps. So if you have that communication with your family, husband, wife, whole family, you don't need anybody outsider to make you self-aware and to help and introspect. And it's an ongoing process. Even at I'm 74 and every year I feel I know a lot, but I learn life's lessons. Every year, every month. You think you know human beings, you think you know about relationships, and suddenly some catastrophe comes and you realize, apne ko to kuch malum nahi. So it's a evolution. Thank you so much. And thank you, Anagha, for the wonderful lecture.
I, Dr. Sanjay Chavan from Department of Pediatrics, would like to thank each one of you. At the outset, I would like to thank our Honorable Chancellor, Dr. P.D. Patil sir, Pro Chancellor, Dr. Bhagyashree Patil Madam, our beloved Treasurer, Yashraj Patil sir, and our Dean Madam, Rekha Madam. And I would like to particularly thank our today's speaker, Jayakar Madam, Dr. Anagha Jayakar Madam, for an excellent and interactive session. And our beloved Swati Bhave Madam, as usual, she is a very good orator from AACCI. And our Sandeep, Dr. Sandeep from AACCI, and National Coordinator, Dr. Samir Shah, and all our online and offline listeners. Thank you one and all. Please join for high tea.
Thank you. Thank you all. Thank you. Tulam, special thank you.
Thank you.
मी येते नंतर. दीन मॅडमकडे घेऊन जा.
No, no, sir.
Yes, ma'am.